the investigation that has garnered the most media interest has been the Canterbury Rehab Center, and I'll tell you that the first good news we've had in many days now is that there are no new deaths in the last 24 hours, thankfully. And it seems to be that the spread of infection may be slowing down. We had a period where we had an increase of 20 or more symptomatic individuals, but in the last 24-hour period, that has been more like 5 or less new symptomatic cases. So we continue to work very closely with the facility. Again, the medical staff there are doing everything they can. As I shared yesterday, the staffing challenges that they're facing are really significant, and both the loss of staff, the loss of nurses and CNAs and LPNs who are either symptomatic themselves and have to be isolated, or who have been potentially exposed and are quarantined. That continues to be a major challenge as they look to enter into new agreements with agency nursing companies. There are barriers for those nurses to only work at one facility, which is really what we're strongly recommending right now. I think in the midst of this outbreak and the fact that we've had some new clusters, which I can talk about in a minute, at other congregate care facilities, I think there's more and more of a need for us to look at restricting the movement of healthcare workers among congregate care facilities. Now, the challenge is that this practice is very widespread, and there are a number of facilities that have staff that work at one place and then may do a double shift at another place. And it's really hard from a staffing perspective for all of these facilities to maintain staffing levels without that practice. And so we're working hard with them to look at their lists, to make the best decisions for their facilities. I'll pause there on Canterbury and see if there are any questions about the Canterbury rehab outbreak.
For some families, they think the only news they may be getting is from maybe these press conferences or other maybe media outlets. What would you say to the families who are worried about their loved ones who are inside that may not be getting the requisite correspondence from the facility, but they're still worried about all the COVID-19 cases that are still coming down?
Yeah, I think it's a major challenge. Again, the staffing is not just affecting the folks on the units in the ward, it's also affecting folks throughout. I mean, everybody's pitching in however they can. And I have received some of those concerns from family members who have routed their concerns through through elected officials or through the county. And so all I can say is that in my regular conversations with the medical director and the administrator there, I'll convey those because I do think it continues to be really important as things do change from day to day, that families at least are briefed on the latest scenario. And so I'll make sure I convey those concerns to the facility. I know they're trying as hard as they can, and I would ask the facility, the residents who understandably are very concerned about their loved ones, to contact the facility directly, and we'll work to see if we can pull together volunteers or some other way to be able to help with outgoing communication for those family members.
I also know that you did kind of speak about the issues that they may be facing is there may be elderly people, that's one condition. Is it the lack of nursing? Is it just the nurses may have contact with themselves? What are the underlying issues that may be affecting that facility that's become such, to quote someone else, a hot spot for the COVID-19?
Yeah, I think it was really the fact that they were on the front end of this before testing was really made widely available, right? So their first case was a week and a half, a little bit longer ago. And at the time when their medical director was concerned about individuals with symptoms, they weren't able to get access to the rapid testing because they didn't meet criteria. So they tested, but they tested at a commercial lab, which had a 4, 6, maybe longer day turnaround. And that delay, I think, really, set them back, because as they were waiting for test results, they were working on isolating patients and creating an isolation ward for symptomatic patients. But the fact that they didn't have access to rapid turnaround testing really has made it difficult for them to combat spread. And it's almost exactly what other large facilities have seen across the country, particularly who are on the front end of this outbreak.
Now, generally, and just for people who don't know, because we're all streaming, but generally for those who don't
Yeah, and it depends on the testing outlet. So, and we've had a lot of new testing capabilities emerge over the last few days. So, for example, VCU has developed its own in-house testing, and so anybody who's hospitalized at VCU, they're able to turn around those tests in about 4 hours. The outsourced testing, so there are a couple of new labs, Genetworks, Next Molecular, that are generally about 48 hours. The state lab is a little bit less than 48 hours, more like 24 hours for the state lab. I think we're still seeing longer delays with the commercial labs like LabCorp and Quest, where those look more like 7 to 9 day turnarounds. And so you can understand how if we're sending labs out and we don't see anything for a week, how challenging a situation that is for facilities that are trying to make decisions in real time. Thankfully, that's changing every day, and so as we're working with other facilities who are now experiencing cases, we're seeing a quicker turnaround on testing, and they're able to respond more actively.
Does the Virginia Department of Health?
Enzo needs to get his story in. Can you let him break
Of course,
down?
yeah. There you go. No, go for it.
Doctor, between Friday and Saturday, there was 2 additional deaths.
Correct.
Can you tell us just a little bit about the victims, just the genders, age?
Yep. There were 2 deaths late on March 27th. The first was a male who was above 90, and there was no testing. He was on the isolation unit and had respiratory symptoms, but what wasn't tested in the window and expired, and was a presumed positive based on symptoms and based on where he was in the isolation. The second was a woman in her 60s who I believe also passed away at the facility. I wasn't able to confirm that based on the line list, but based on Dr. Wright's communication to us, it looks like she did pass away at the facility and had a positive outside test. So as I described yesterday, that there's some discrepancy between some of the outside testing labs and what get confirmed through the state lab. I think she was, but I know that she had a positive outside test. It'll just take us a little bit more time to confirm that through VDH.
Do we know if they got this from community spread?
These are long-term residents, and so they are part of the cluster of illness that we're seeing within Canterbury Rehab.
Doctor, is there any indication of how the virus first got introduced there? Was travel or some trace that?
Yeah, in all of our workup, we have not really been able to identify, an index case, which is usually what we're looking for in these epidemiologic investigations. And I would say that the most challenging part of this is that there is some evidence of asymptomatic spread here, likely, and throughout the country. And so it's really hard to know, was this a patient who was, went to the hospital for a visit and came back? Was it a healthcare worker who came in? The timing of the testing really doesn't point clearly to who was the first case.
Doctor, you mentioned slow and spread. Do you mean just in Canterbury or in the region itself?
No, at Canterbury in particular. At Canterbury Rehab, we had a couple days where we were seeing significant, day-to-day increase in the number of symptomatic individuals, and that has really started to tail off. At this point, it's about a third of the facility who is in that isolation ward are showing symptoms or have been confirmed as positive in the facility.
Since it's so low, do you expect these numbers to rise at all, or deaths?
I hope not. I think that, the facility continues to adapt every day. The health department and the health systems have all been working hand in hand, and the county have all been working hand in hand with the facility to increase the amount of access to PPE that they have, and that's increased significantly. Some of the other changes that we've made over the weekend, we have identified kind of hot and cold zones. So almost like an acute care hospital during times of Ebola, we're having to adapt those kinds of infection control strategies into a rehab facility that normally would never have any experience doing something like this. But because of the nature of this disease, how transmissible it is, and the case fatality rate for this population in particular, we're really having to adapt strategies that we would use in hospitals for this rehab facility. So our epidemiologist spent a fair amount of time there during the day on Saturday. We set up showers so that when folks are leaving the facility, they can shower, get into clean clothes, and go home so that they're not taking home any potential for spread. They also set up 2 tented areas for workers to be able to take breaks. One for the isolation ward that has symptomatic patients, one for the other 2 units. In both of them, they've got foot baths with bleach solution to be able to just in every way that we can think of to try to limit carriage of the virus. We actually just an hour and a half ago were on the phone with the CDC and colleagues from King County in Washington State, because they had obviously the most covered outbreak in a nursing home at the very beginning of this pandemic coming to the United States. They now have 55 long-term care facilities that are experiencing clusters and outbreaks, and so they, unfortunately for them, they've had weeks of preparation or experience dealing with this. And so myself, the state epidemiologist, our EPIs from the county and the hospital acquired infection division at VDH, we're all on the phone with the team from Washington, learning from their experience. And here's the tough part, is that there's not a lot that we're not doing currently. So in some ways that was affirming that we've followed the guidance, we're taking the right steps. In other ways, it was disheartening, because while we're taking all of those steps, we're still seeing the spread in this facility and in other facilities as well. And I think, for King County, they learned a lot from that first experience with Life Care, yet they now are dealing with 55 outbreaks across the county. So I think it says something about the challenge of trying to control a disease in an environment with limited PPE, lags in test turnaround, and the reality that this is sometimes spreading without any indication whatsoever. Yeah, I think that we are approximately a month into, after our first case. If we look at the outbreaks in other countries, in China and South Korea and Italy, it was 3 months or longer before they got to the other side of the peak. And so if I had to guess, I would say probably 6 weeks from now. My hope is that that peak is lower and comes we're able to sort of fend it off with the significant physical distancing, social isolation that we've been doing, school closures, closure of restaurants. But I would say that happened in other countries as well, and they still, followed about a 3-month trajectory.
I kind of want to go back to. I apologize for going back to.
No, it's fine.
Can families go get their loved ones if they're already there? Is that something that they can do?
Can they get them and pull them out, you're saying?
Yes, can they go and I don't know the medical word for relieving
Discharge.
discharge from
Yeah,
the
I mean, I think that the reality is that many of the patients who live at Canterbury Rehab and other facilities like it are there because it would be extremely difficult for them to be cared for at home. And so if a family, had the ability and maybe had extra hands at home and maybe the resources to bring in some degree of home nursing, that might be possible. I think it's exceedingly unlikely that another facility would accept a transfer at this point. So yeah, we've had some of those questions from family members. I don't think the facility would have any would resist that at all. I think the facility would say, yeah, if you have an opportunity to provide the care that your loved one needs at home, by all means, do that. But I think that given the degree of whether it's dementia or significant physical debilitation that many of the residents of this facility have, that would be challenging.
My last question, I promise.
You're good.
Have any cases of the coronavirus in Canterbury recovered? Has anyone recovered, and how many have you?
There are some folks who are getting better. They have about 6 or 7 individuals who are still currently hospitalized, and based on Dr. Wright's notes, it seems like 3 of them are starting to actually improve in their status in the hospital. So I think they likely will be hospitalized for a few more days, but things look good right now. Yeah.
You mentioned briefly that there were other facilities that
Yeah.
were. Could you speak a little bit about
Yeah,
that?
so there are a number of clusters that we have started. We got positive cases in over the last 24 hours. My epidemiologists were in 3 of those facilities today. I am at liberty to share 2 of them. There are other, and you all can understand that I need to ensure that we're in lockstep with the leadership of those facilities, because it would be terrible for the family members of those residents to hear something on the media that they're not hearing from directly from the facility. And so I really want to make sure that we've made those connections with the leaders of those facilities. But we've been able to do that in 2 cases. Beth Shalom actually did their own press release a couple of days ago with their first case, and at this point they have 3 positive cases. One was, and 2 of those cases were both on the same wing at Beth Shalom. They are all currently at the hospital, and so there are no active cases at Beth Shalom. And again, our epidemiologists have now been there twice. Lots of confidence in the steps that they've taken. I mean, I think so many of these facilities have been preparing for weeks for this inevitability. Thankfully, the folks at Beth Shalom also have the ability to isolate cases into an isolation ward. I think some of our learning from Canterbury and from our conversation with our colleagues in the state of Washington, where our epidemiologists are actually, I just came from a phone conversation where they're still discussing what else can we learn from those other cases that we can put into practice at Beth Shalom and at other facilities. The third would be the Masonic Home, which is in eastern Henrico. We received over the last 24 hours 3 confirmed positive cases at the Masonic Home. They're a large facility, about 200 residents, about 50 or so that are in independent living, 100 that are in assisted living, and then 50 in that memory care and skilled nursing. Their 3 cases are all in that skilled nursing wing. They are all stable at the facility. None of them have severe enough symptoms to be hospitalized at this point. And 2 have respiratory symptoms. 1 has a fever. And so we'll be continuing to work closely with Masonic Home to help contain spread there.
I'm going to ask about Canterbury again. The 8
Sure.
people that died, are they dying at the hospital, or do they remain at the facility once they're diagnosed?
Of the 8, I have 4 that died at the hospital, 3 that died at the facility, and 1 that I'm not sure about. 1 that wasn't clear in the line list. Yeah.
Dr. White, I think I read this in the RTP that the really elderly gentleman, the 9-year-old, just became symptomatic and died within, I think it was 2 test, right?
Hmm.
Maybe within 24 hours or so.
It's possible. I have not talked to Dr. Wright specifically about that case. I think the RTD was able to make a connection with him, but I haven't been able to go into that level of detail on each case, unfortunately. Yeah.
You mentioned that there's certain things that they were doing. That maybe might have been done in cases with Ebola or something like that. Could you go into some detail that non-medical?
Sure. I think that skilled nursing facilities, rehab facilities, are particularly challenging places for controlling infection because the degree of healthcare intervention that each of those residents requires. So in addition to a physician visit once or maybe more times a day, it's frequent nurse visits, it's frequent LPN visits, it's therapists, it's physical therapy, occupational therapy, and these residents require a lot of support and therefore a lot of touches by healthcare workers. So as we were just talking to our colleagues in Seattle, I mean, there's this kind of collective, deep understanding that these facilities are at higher risk because of the nature of the care that is delivered. But they're not hospitals, and so historically they have not, adopted the extent of infection control protocols that you might see in a surgery suite or in an intensive care unit. But given the degree of spread that we've seen at Canterbury Rehab, we've started to adapt some of those practices into place. So things like that I mentioned, things like the foot washing to kill virus that may be on fomites, on the actual particles on gowns and on shoes. The establishment of single entry and single exit, so that people come in with clean PPE, discard it, and exit, through dirty PPE exit. Actually using tape to mark out pathways on a unit to say, hey, here's your hot zone, here's your cold zone. So, those kinds of interventions to just increase the awareness and the practices of infection control are being put into place. And I hope that those are the kinds of things that are leading to a decrease in the new symptomatic individual count that we're seeing at Canterbury. And if I think, if we were to see that degree of spread, and it may be that we should start doing this proactively at other facilities that are starting to see smaller clusters. And so these are the kinds of conversations we'll be engaging with the leadership of those facilities moving forward.
I know this is really getting in already, but would you say the cost?
Yeah, sure. So in outside of the isolation unit where symptomatic individuals are through the exit, there's a tented area where the staff can go and take breaks. In that tented area, there's a foot wash tub with bleach solution so that they can step in that with their shoes and just limit the carriage of the virus in and out of the hospital. So these are the kinds of interventions that again, acute care hospitals and really significant disease transmission circumstances are putting into place, and we're doing this now at a skilled nursing facility.
Hey, if you don't mind, can we let the TV guys go ahead and wrap up, and then you guys got
You good? You lost Enzo? Good? Okay. Great. Samuel?
Yeah, I wanted to go back to the staffing thing. And you said that it's advisable not to have staff going to different facilities if they are exposed, quarantining. What are you going to do to fill the shortages left there, and where does the staff that they need to keep doing this kind of care come from if there's so much of it getting kept out?
Yeah, it's a great question and what we're trying to work on right now. So here's some of the practical things that we've done. One, we have reached out to a number of different nursing agencies, and the folks at Canterbury Rehab have been doing this on their own as well. We're using anybody in our network and trying to connect them to be able to supply new staff. Two, the county reached out to the community college to see if there are nursing students or nursing faculty who might be able to step into this circumstance given just the severe need for staff that they have. Three, we have made a request through our Medical Reserve Corps, which is our volunteer network, to see if there are any nurses, LPNs, or CNAs who would be willing to pull volunteer shifts at this facility. Four, we haven't, I reached out today to one of my contacts in home nursing to try to figure out if home visiting nurses are doing less and less home visitation, if they don't have as much work, then it's possible that we could redeploy them in this facility. And then five, we haven't started this yet, but someone gave me a great idea earlier today. She let me know that a number of facilities have had to furlough workers who have kids at home. So facilities that may be congregate care facilities for the elderly who just couldn't take the risk of them going home to children and potentially bringing back virus. So it's possible that those furloughed workers might be able to be redeployed in scenarios like this. So there are a number of strategies that we're trying to use. and I think we've got to deal with the reality that there's a certain degree of anxiety and stigma related to this facility, where people might just say, I'm not really willing to put myself at risk in that facility, and so that's a reality of what Canterbury and their team is dealing with right now.
Off the top of your head, how many cases they have? I don't think Canterbury puts in that.
Yeah, I think the last number I had was about 52. Sorry, I should be clear that 52 does include the residents who have passed away, and then a number of those who actually have confirmed tests. And I just haven't done the numbers. I mean, it's probably somewhere around, of the 8 who have passed away, there are remaining, 46, 44. It's probably upper 20s that are confirmed positives versus waiting on or presumed positive.
Okay, because they said, I think they're up to 37 that they
Confirmed positive now?
confirmed
Got you.
positive.
Okay.
So 52 would encompass all that.
Yeah,
Okay.
correct.
And are they, if they're still awaiting test results, or they think someone has it, is that in a separate, is there a wing for the positives, a wing for the presumed, and then?
Yeah, exactly. So they have an entire unit that is either confirmed or suspected, and then within that unit they've got 3 different hallways. So the confirmed are sequestered from the presumed. So just in case they're negative, they're ideally limiting cross contamination there.
So just so my math is correct, there have been 37 confirmed cases. There have been 8 that have passed away. That make 45.
Okay.
There are 7 other cases. What are the 7?
I can't confirm those numbers because I didn't actually even have the 37. I have the line list from today, but I just haven't broken it down into who's confirmed, who's presumed, who's waiting on test results. Yeah.
As of right now, 52 current cases, including the deceased.
Yeah, and that's an approximate 52, including the deceased. Yeah. Yeah.
Correct me if I'm wrong, but I think today was the single largest confirmed case increase since we had the first one.
In the state of Virginia or in the U.S.?
Virginia.
Okay.
150 or so.
Got you.
Today.
Haven't actually looked at today's numbers.
Are we still in the phase where that record's just going to keep getting
Yeah,
for a while?
yeah. I mean, I think I said earlier this week when we were hovering around 200, 250 cases, when we looked at the spread of this outbreak in other states like Michigan, Louisiana, and Illinois, a little over a week ago, they were between 200 and 400 cases, and then just over a week, 8 or 9 days later, they were at 10 times that, somewhere between 2,500 and 3,500 cases. And I think particularly the way that this disease is spreading and the fact that we are every day increasing access to testing, I would not at all be surprised if Virginia was in the same boat, seeing a 10x increase from earlier this week to sometime next week.
So just so we're clear, you think the numbers have been, not have been, but the numbers are low as of now because of the lack of testing, or is it the lack of people actually getting it, or is it just?
I absolutely think that there are a number of folks in our community who have the disease, but until the last few days where they've had options to go to an urgent care center or their primary care doc, have our recommendation for the last couple of weeks is that if you've got mild illness, call your provider if you want to be tested. Most providers weren't testing at that point, and so we said isolate at home, stay until your symptoms resolve. 3 criteria we want you to meet before you're released. 1, that you have had at least 72 hours fever-free without the use of medication. 2, that you've had complete resolution of your respiratory symptoms. And 3, that it's been at least 7 days from the day of onset of your symptoms. And if you meet all 3 of those criteria, you can go back to work or stop your self-isolation. I suspect that there are hundreds, if not more, of those cases who are folks just who had mild illness who were never tested and aren't adding to our case count. That number is just, it's growing every day.
The University of Washington's Center, forget the acronym, they've been putting out projections of number of cases and deaths in the country and the state. I think they have Virginia somewhere around 1,500 by the beginning of August for number of deaths
Yeah, I mean,
Sam, you understand that Dr. Avula is Richmond and Henrico focused.
sure.
Some of the questions about what's going on statewide, you wouldn't expect him to be fully up to speed.
Yeah. We heard from Dr. Fauci that U.S. could have 100,000 deaths, and I'm not sure what modeling has been done around that. I think the reality is that this doesn't just end in August, right? I mean, we're going to have a whole nother round of this disease before a vaccine has been developed, and we've got to be prepared for that. And I think, the death tolls very much could exceed 1,000 over the next few months. I think we have not even seen. We're at the very front end of hospitalized cases. We've had about a 10% increase in hospital bed occupancy over the last couple of days. I fully expect 2 weeks from now that every one of our health systems is going to be, near or at its limit. And thankfully, our health systems have been touching base every single day. The leaders from our 3 health systems have been planning for weeks around how do we deal with surge. They've identified alternate facilities. They are thinking about what kinds of models of field hospitals could we put in play. We have requested, a surge of ventilators from the Strategic National Stockpile. The challenge is that everybody in the country has requested those, and so our ability to lean on that is going to be fairly limited. This is a real concerning issue for health systems in particular, and those numbers don't sound unreasonable to me.
Dr. When you started, you said you were pleased, or at least it was a little good news that you hadn't seen such an increase at Canterbury
Yeah.
in the last 24 hours. I think there might just be a lag with when they put out the releases. What I got today, to me, looked like the biggest increase was 2 more deaths, and then they said 18 more infected. So, but maybe those.
That was from a couple of days ago, yeah. So I had a text exchange with Dr. Wright. He said, no new deaths in the last 24 hours and only 2 new symptomatic individuals over the last 24 hours. So I think there was probably a collective over a few days that contributed to that.
We're going to draw this to a conclusion soon, so if you've got any burning questions, get them in now.
Good?
Thanks for your time.
Yeah, of course. I'm sure we'll be back at it in a couple days, I would guess. But thanks all.